to scale up the preparedness to deal with COVID-19. Not an unexpected inflow of people from previously locked counties is imminent. With 278 new cases recorded in the last briefing, Kenya now has a total of 8,528 COVID-19 cases. The CS spoke in Makueni County, which is also ramping up its capacity. Well, let's stay with the county preparedness and speak to KTN's Ibrahim Karanja, who is in Laikipia County. Ibrahim, how well is the county prepared to deal with COVID-19?
Well, good afternoon, Michelle. The level of county preparedness, especially at this time when the partial lockdown of Nairobi, Mandera and Mombasa counties was lifted, goes to the equipment in the health facilities and the number of staff. And this is what you're talking about with Laikipia Governor, the Honorable Nderito Moreithi, to get to understand exactly how Laikipia County is prepared, the challenges they could be facing, especially in provision of health services, especially on COVID-19. Thank you so much, Governor, for finding time to talk to us. Let's start by the level of preparedness for Laikipia County. Now that actually what the CS Health said is that there will be no more airlifting to Nairobi of COVID-19 patients. How well is Laikipia prepared? And
the reality is that we've never assumed that there will be any airlifting. So I'm not sure where my friend and colleague Senator Kagwe gets that idea. We've never assumed there would be any airlifting. Because remember, we run a referral system. And that referral system, I'd say at Kenyatta National, will already be overwhelmed. So you'll be referring to who? Even more closer to home, say at Nyeri PGH or at the Olaya Annex of Kenyatta National, they will themselves be overwhelmed. So our minds and our actions have been very clear from day one. We expect to have capacity to treat Kenyans here in our county. But I think what we should be addressing is the corrupt bureaucracy of government, particularly national government. And I think Kagwe himself has said there are corrupt cartels at Afya House. That makes it damn near impossible to provide the right care of service. Just to give you one instance, our ventilators, some of our ventilators and ventilator components, because you know we are manufacturing ventilators with Dedan Kimathi University, have been lying at Jomo Kenyatta for 10 days. 10 days. When some officials, like Mohammed Malik, somebody, cannot be found to release, we have sourced components globally. They have arrived at Jomo Kenyatta. 10 days later, they are still lying there because of the corruption that is in the customs department. So if DCI and any other investigatory organ, EACC and others, that's where they should be camped. And those are the questions they should be answering. How can medical equipment be lying at Jomo Kenyatta, not cleared, for 10 days? Well, those are the right questions we should be asking.
Governor, you're talking about medical equipment lying at the airport. And when we are talking about county preparedness, these are the things we are looking at. The number of ICU beds, the number of ventilators that counties are having. Perhaps, are you stating that the challenges is not actually lying with the counties, but with other...
I'm telling you, right now, if you go to Jomo Kenyatta, you will find nearly 20 ventilators and ventilator-making components belonging to us that have been sitting there. Yeah, and we would like the KRA and the Customs Department to explain. And we refuse to pay bribes, and we will not. And we want to encourage the DCI and the EACC to come down. And one particular official called Malik.
Governor, let's refrain from mentioning names, but these are, of course, is something.
I mean, this is the official that has been found. Clear our goods. Why don't you want us to mention people by name?
For the sake of...
People are corrupt as individuals. And this is that there is an official...
Governor, let's for the sake also of our right of reply, which we shall be looking for.
Him. I will give you his phone number and you can call him.
Okay. Finally, let's talk about now Laikipia County. Do we have any active cases currently? And now, in terms of our health facilities in Laikipia, talk about workforce, talk about what is needed. Where is Laikipia currently?
Why do you want us to go over the same subject matter over and over. You know, we have an ICU facility in Nyanyuki. You know we have an ICU facility in Nyahururu. You know we have an annex hospital right now with 141 beds. You know we have a mother-child coming on stream with another 112 beds in Nyanyuki. You know we have 112 beds coming on stream in Nyahururu. Yeah? The real news is what I'm explaining to you, that corrupt officials, customs officials, who are holding up medical equipment at JKA. You saw the other day when donations from Jack Ma and others were being diverted at the same place. That's where the news is. Yeah, we've been prepared. We've been working overtime. Since this disease started, you know that we have screened over 1.38 million passengers or citizens who coming in or through Laikipia. We've been working from day one.
What are you being told is the challenge at the airport? And then tell you, is it only Laikipia or other counties going through?
I'm able to speak for other counties, but what Kenyans should know is that corruption at customs clearance is holding up essential medical supplies, including ventilators. We are unable to complete 15 ventilators that are under manufacture because of those delays. And that's what Kenyans need to know. And that is what I would like the DCI to address himself too. That's what we would like the EACC to address themselves too. Because we keep pushing the blame to counties, asking counties how prepared are you, instead of focusing on the processes that assist us to be prepared. Yeah? Laikipia County, you know that our budget, the bulk of our budget is focused on health. You know already that an additional 152, now actually nearly 200 additional personnel have come on board. Yeah. But the number one roadblock to preparedness is not just bureaucracy, but corrupt bureaucracy. Yeah? That makes it near impossible. Why should equipment be lying under clearance for 10 days? What possible justification in the universe can there be for that kind of behavior? Thank you.
Thank you. Well, a clearly frustrated, agitated governor of Laikipia County, Nderito Mureithi, expressing his frustration over that allegation. He actually says that fact that there are equipment lying at the airport due to what he terms as corrupt custom department at the airport, saying for 10 days equipment for Laikipia County, ventilators,